Thank you for choosing Hanger Clinic. We are here to help make your family's experience as easy and seamless as possible by ensuring you feel confident navigating your cranial remolding journey. Your baby's cranial remolding orthosis, commonly known as a cranial helmet, has been custom designed to improve the symmetry of your child's cranial deformation. Today, we will review some instructions that will help you correctly use and care for the device. If at any point you have specific questions about the treatment plan, please contact your Hanger Clinic orthotist. What to expect? Your orthotist will ensure your baby's cranial helmet fits appropriately while allowing room for their head to grow. To correctly apply and remove the cranial helmet, open and close it from the side. The brim of the cranial helmet should sit just above your baby's eyebrows. To achieve the goals for your child, the cranial helmet needs to be worn for 23 hours a day. This will ensure proper redirection of your baby's head growth and help achieve the desired outcomes. The 1 hour per day the cranial helmet is not worn by your child can be broken up throughout the day. At first, your baby may be aware of the cranial helmet, but they will likely adapt quickly. Sometimes it may be more of a challenge for you, the parent, because you naturally want to minimize your baby's response and relieve anxieties. Wearing schedule. Your clinician will provide a wearing schedule that will help gradually increase the number of hours per day the cranial helmet is worn. The recommended 23 hours per day wearing time will be reached in about a week. A typical wearing schedule may look something like this. Day 1, 1 hour on and 1 hour off while your child is awake. When your child is napping or asleep for the night, they do not need to wear the helmet. Repeat throughout the day until bedtime. Day 2, 2 hours on and 1 hour off while your child is awake. Repeat again until bedtime. Day 3, 4 hours on and 1 hour off while your child is awake. At this point, your child will also keep the helmet on during nap time. Again, repeat until bedtime. Day 4, 6 hours on and 1 hour off while your child is awake. Day 5, 6 to 8 hours on and 1 hour off. Naps included, no helmet yet overnight. Day 6, 8 hours on and 1 hour off. On the 6th day, you'll introduce the helmet overnight. Day 7, 23 hours on and 1 hour off, achieving the full time goal. Cleaning instructions. You should expect your baby's head to sweat, especially during the first few weeks. When you remove the cranial helmet for bathing, it is a good time to wash and disinfect the helmet. During the first few weeks, it may be advisable to clean the cranial helmet twice a day. You can clean the cranial helmet with your baby's soap or shampoo. Use a damp washcloth or brush with the soap or shampoo to gently scrub the inside and outside of the cranial helmet. Allow the helmet to air dry for 15 minutes. Should disinfectant be needed, you can use 70% rubbing alcohol on a clean cloth and can wipe down the inside and outside of the helmet. Ensure that your child's helmet is completely dry before putting it back on. Appointment schedule. Your clinician will schedule routine follow-ups to review your baby's progress over the coming weeks and months. As you go through the journey, remember you are not alone. Your Hanger Clinic orthotist is available to answer your questions and would be happy to connect you with parents in your area who have been through this process before. Visit hangerclinic.com/cranial to learn more.